My name is Chantelle, and in this presentation we'll be thinking through the fundamentals of undertaking a carbon footprint as applied to the healthcare setting, and hopefully this will be helpful when accessing carbon footprints published in the literature and others that you might see in various other reports. So firstly, what is a carbon footprint? Well, a carbon footprint is an estimate of the greenhouse gas emissions that are associated with a given product or process. And we look at a variety of different greenhouse gas emissions, and we convert this into carbon dioxide equivalents based on the global warming potential of those greenhouse gases. And what's the purpose of undertaking a carbon footprint? Well, the absolute figure that we get, the final result, actually isn't the most important thing. What's more helpful is using a carbon footprint as a tool to help us understand how we can bring about change in clinical practice or in policy to bring down our real world greenhouse gas emissions. And to do this, we can think about framing carbon footprints along the lines of four key purposes. One might be to evaluate the baseline greenhouse gas emissions associated with a given process, and to actually monitor progress over time. And we might do that at a national level or at a more local level, for example. The second key area is to actually understand what are those key drivers of greenhouse gas emissions and to identify carbon hotspots within a given system. And those are the areas that we can really tackle in terms of the changes that we make. We can also use a consistent method to compare the carbon footprint of alternative products where we've used a consistent method within a given study. And the fourth really useful thing that we can do is to actually model ways that we can optimize and mitigate the environmental impact associated with a given process. And there are two key approaches that we can use for undertaking a carbon footprint. And we can think of these in terms of a top-down versus a bottom-up approach. And the first and the very most simplest way that we can undertake a carbon footprint is what's called an environmentally extended input-output model based on financial spend data. And as you'll be aware, the financial spend is something that we often have ready access to. And so we can much more quickly collect the data. And then we convert that to the carbon footprint based on industry-specific conversion factors. And the other advantage of this approach is that the financial cost often takes into account the upstream hidden sectors. So, for example, the cost of a product might include a proportion of the marketing and of the research and development that's gone into that product itself. But the disadvantage, as you might spot, is that this approach lacks granularity. We don't get that much useful information from it. And oftentimes we see that the price doesn't actually reflect those material and energy flows. So it's rather limited there. So the second key approach is a process-based bottom-up approach. And here we collect data in as much detail on all the material and energy flows associated with a given system. And that might relate to the energy consumption, the transportation, the materials that are used, for example, in as much detail as possible. And we can then equate that and use conversion factors to convert that into a carbon footprint. And the advantage of this is that we get a lot more detail and a lot more specificity. But the disadvantage is that we're essentially choosing what we include and exclude from that analysis, and so there might be a gap between what we measure and the real net greenhouse gas emissions that are released. And it's also a lot more resource intensive, both in terms of time and greater expertise is typically required to undertake these sorts of analysis, and often might rely on more specialist equipment. The third approach is to actually use a hybrid where we might use financial data, for example, for some elements of a study, and then process-based for others where we have that data available. And a typical area that we often fall back on the financial spend data is pharmaceutical products. We've got much less availability of conversion factors there. And the other important thing to think about is actually contextualizing carbon footprints within life cycle assessments, which you may have heard about. And really, a life cycle assessment is a much broader evaluation where we can evaluate a whole range of different environmental impact categories. And they, for example, might include looking at wider impacts on eutrophication, ecotoxicity, ozone depletion. You'll see in red there I've highlighted global warming. So that's the carbon footprint. And you'll see that the carbon footprint is in fact a subset of a life cycle assessment. And the advantage of undertaking a life cycle assessment is that we can also convert those array of midpoint environmental impact categories, and we can aggregate this to give an estimate of the impact that this then has on human health. We know that climate change is the greatest greatest threat to human health of the 21st century. And in fact, we can estimate the disability associated life years associated with that life cycle assessment. And the other terminology, just to be clear on, is that a life cycle approach can be used to both a carbon footprint and a full life cycle assessment analysis. And a life cycle approach refers to the approach that we take when we think about products in these analysis. And we typically look from cradle to grave at all of the associated processes. And this will include, for example, the raw material extraction, the manufacturing process, the distribution, the use phase, which for reusables will include looking at the reprocessing, so any decontamination, any laundering, for example, all the way through to the final disposal. And there are a number of guidelines that can be used to support us in undertaking these analysis and providing guidance in terms of how we undertake these sorts of analysis. But essentially, there are 4 key stages and steps that we will follow in undertaking a carbon footprint. And the first is being really clear about the goal and scope of the carbon footprint. And this involves, firstly, defining the research question. And I'd encourage you, if you're thinking about doing these sorts of analysis yourself, to really frame this around one or more of those 4 key purposes that we thought about earlier on within the session. And within the goal and scope, it's also really important to define the functional unit. That functional unit might be an individual product. It might be a given clinical patient pathway. It could be a whole hospital. It could be a national healthcare system. And within the goal and scope, we also define the system boundary. And this will be specifying what material and energy flows are included and excluded from the analysis. And as a rule of thumb, we should be including anything that's materially relevant. And by that, we mean anything that's likely to contribute at least 1% to the overall analysis. So the second key stage is to undertake a life cycle inventory, and this is where we collate our data to support our carbon footprint. And here we are going to be either collating financial activity data if we're doing that top-down environmentally extended input-output model, or we might be collating activity data if we are undertaking the process-based approach. And we can use primary or secondary data for either of these. There are instances where we can actually collate direct emissions data also. And then it's a question of converting that data, financial or activity data, into the carbon footprint. And there are a whole host of sources of those emission factors, the conversion factors. And I put a couple on the screen there that are typically used for the process-based approach, including the UK government conversion factors. And a really useful one, if you're looking at materials specifically, is the ICE database. And the fourth and final stage, which is perhaps most interesting, is actually the interpretation of those results and undertaking any sensitivity analysis. So having identified the hotspots and the major contributors to a given product or process, we can then actually undertake some modelling to evaluate what happens if we change some of those parameters. So I put on the screen there an example from my own work where I'm looking at repair of surgical scissors. And here I looked at the impact of changing the number of repairs, changing the number of scissors, altering the country in which the analysis was undertaken, as well as looking at differences in terms of the different waste streams that might be used. And this sort of thing is really helpful in understanding how we might be able to reduce the impacts further, as well as improving the generalizability of some of those findings. And finally, we'll come on to consider where we need to apply caution and to avoid common pitfalls in terms of interpreting carbon footprinting studies. And certainly when we get those initial absolute figures and the key findings, it's really helpful for us to compare those to other studies that might have been undertaken, and to contextualize those based on findings, for example, from reviews in the field. And if we take an example from single-use versus reusable items, we know that systematic review found that we can actually see average reductions of 38 to 50% through switching from single-use items within a healthcare context to reusable. So studies indicating to the contrary, we need to really unpick these and understand why. It's really important also to check and confirm that the functional unit for any comparative studies truly are comparable. So if we're comparing product X with product Y, are they actually serving a comparable function? And we touched earlier on truncation error, which is essentially the gap between what we measure and the estimate of the greenhouse gases versus the true net greenhouse gas emissions. And there will always be a gap, and it's just being aware that the absolute figure is not necessarily the exact. It's always going to be an estimate. And if we're looking to apply the carbon footprinting studies to our own context, it's also important to consider the generalizability in terms of the products themselves, but also looking at the country in which these analyses were undertaken. And something that's really important is looking at studies, for example, undertaken within an Australian context, which uses a much higher proportion of coal within its energy mix. And so oftentimes we see that those results are not necessarily translatable to other settings. And we need to be conscious that the use of different conversion factors and different sources of emission factors will have an impact on results. So if we take as an example, if I've used 10 kilowatt hours of electricity and I look that up in the UK government database, that's the DEFRA-based database, I will get about a 13% difference to if I look that up in eco-invent, which is commonly used for life cycle assessments. And there's no difference in terms of the real net impact, but it's just about the data sources that I might have used. And as with all critical appraisal, we need to be really critical and questioning of the methodological assumptions that are made within a given study, and considering whether these are actually applicable to our own setting. And finally, we need to be really conscious and aware of lack of transparency. And certainly within carbon footprinting studies, it's really important that the full life cycle inventory and that data is made available, so that we can actually evaluate this ourselves and to understand to what extent this study applies to my context.